everybody. My name is Dawn Lacklade, and I'm the Chief Strategist here at LiveWorld. And I just wanted to share a few things that we have on our mind in hopes that they help to inform your strategy for this coming year. So first, let's talk about a couple of opportunities or missed opportunities we see kind of across the industry. So first, the social media shakeup is what I'm calling this. We know and have known for a long time that people are shifting where they're spending time in social media, and it's really important that we know where they're going and how they're spending time. So let's talk about what's changing and what platforms you should be thinking about. So, why people are shifting, some of it's pretty obvious. The changes in X and the potential loss of TikTok have driven people to other channels. Also, the political divide is moving people to different channels. And finally, some of the channels have changed their practices. Particularly Meta has changed the way that we can, what tracking we have, and some of the opportunities we have for more lower funnel campaigns with a change that came at the beginning of this year. So all of those things drive us to be looking around at what other channels there are out there and other platforms that we might consider. So, that might lead you to think about some of these perhaps. And in case you're not aware, both Reddit and Pinterest have started allowing branded pharma ads recently. And so they're a very interesting audience and an interesting space. We're going to talk a little about why they're so interesting. YouTube as well, especially with their SEO tie-ins that are of high value. LinkedIn is a great platform to reach HCPs. And we're seeing more and more branded campaigns on LinkedIn. TikTok is still here and is still very effective. And then Snapchat is something we haven't thought about in a while, but it's making a bit of a resurgence as these other channels fluctuate a little bit. So let's start by taking a look at Reddit, since it's relatively new on the scene. Reddit is a very interesting platform. It's a group of communities or subreddits about different topics of interest to folks. But what's most compelling to me for as a reason why we should be considering this platform is there's so much of the audience that is on Reddit that is not available or not on other channels. So this is a net unique audience in most cases, as you can see as this chart kind of indicates. The other thing that makes Reddit particularly compelling to me is Reddit has a culture of correcting misinformation. For healthcare communities, we see a lot of those are actually led by healthcare providers, whether it's nurses or PAs and APs or APPs, or if it's HCPs themselves. We see a lot of these being managed by those healthcare providers, so they tend to have more credible content on them. As a culture, Reddit does a really good job of correcting misinformation, and that in itself is really valuable to healthcare clients. Now, Reddit as well as Pinterest have both created ads that are specific to pharma that have all of the requirements that we need. And this first example you can see looks very much like the types of ads we've had on Meta for some time or on X. So they should be very comfortable for your MRL team and not be anything too out of the normal. Now, Reddit also has other ad types like this example that shows up with a small frame of the content, but when you open it, it has a much larger format ad type. And we do see subreddits that are specific to HCPs, for example, where an ad type like this might be hugely useful. On Pinterest, one of the reasons that we find this platform so captivating is that it is a very positive platform. If you're not a Pinterest user, it's a collection of ideas, not necessarily content or opinions. So the ideas on Pinterest are very much a positive place to be. As a matter of fact, it was ranked #1 among social platforms as having the most positive content and the most positive impact on people's lives. So it's a really popular place to be. And one of the things that makes it a little bit different is if you browse Pinterest, you see content in batches. Now, this is a browser version from a computer, but even on your phone, you see content in multiple posts, which means you have a unique type of content you need to create, including a cover image or a video here that gives the value proposition of clicking through to your content and your link, and using tactics that will draw in attention. So, for example, if you have all that content, using movement is a huge value, color, giving them that what's in it for them on that very first slide. There's a lot of tactics we would use to reach this audience. And you can see here in this example, that kind of content really does resonate. So Pinterest is another platform that we think is really valuable. So as you're thinking about your strategy and what platforms you're on, with the migration, make sure your audience really is on the platform where you're creating content and where you're presenting your content. The second missed opportunity we're calling the opportunity, and that's APPs. So physician's assistants and nurse practitioner are an additional group of healthcare providers that in the United States, there's about 560,000 of them. And they prescribe 29% of the prescriptions in the US, which accounts for about 1.2 billion prescriptions in the US. Now, that's a significant audience that a lot of pharma companies are not particularly paying attention to. And over time, this audience is going to become even more important for us. And let me explain why. So I'm calling this the care crisis. Two things are going to happen at the same time. First, our aging population of those over 65 is going to grow by 34%. And at the same time, the providers who would be giving them care, 25% of those providers are going to reach retirement age. Now, that doesn't necessarily mean they're all going to retire, but when they reach that retirement age, it's a much higher risk. So that's expected to drive a significant shortage of providers. And that shortage is anticipated to be up to 44,000 primary care physicians in the US and almost 45,000 specialty physicians. So the reason this is important to understand is these APPs, NPs, and PAs will help to fill this gap. And they're already started in that role, but it's going to get much more significant over time. So creating a strategy that reaches these folks is really valuable to you, not only for now, but for your future business. So why is it that we have kind of ignored this audience for so long? Well, it's because there's a significant number of myths out there about APPs. And these are such a pervasive myths that we actually even see them in ChatGPT and those kinds of tools that are scraping this information from across the web. So some of the myths are that they don't have the opportunity, they don't make the care decisions, they don't pick the prescriptions, they're not the ones prescribing them, they don't do specialty medications or aren't specialists. They don't operate independently and make their own decisions, or they're somehow behind on the latest science, or that their care is lesser than their physician provider partners. And those are just absolutely myths. And so let me share a little bit more about who this audience is and how they provide healthcare. First thing to know is that APPs are very patient-centric. And we see them spending more time with patients, and that includes having a little bit more of a holistic view of the patient, being more in tune to the patient journey, and we see a lot less medical gaslighting or dismissal of symptoms among APPs because they do take that time to really connect with you and understand what's going on. We see that they are effective, very effective at getting pre-authorizations done, primarily because we see HCPs tend to hand that off to a staff person to take care of, while APPs tend to do that themselves. So they often are faster to get those approvals and more diligent in making sure that they've completed all the steps they need to. In really complex conditions, we find these folks stepping in as kind of the care coordinator across multiple specialties. So in addition to having influence within the practice or within their specialty area, they often also have influence to external folks when they're in these care coordinator roles. We also see that they spend that time to educate and empower their patients. So a lot of times they will have less medications that are left at the pharmacy or orphaned at the pharmacy, because that's often done because patients have concerns about side effects or are unclear on the use of the medication, where this type of dialogue is really driving those patients to ask those questions in person and ultimately to pick up that prescription. We also see better adherence to medication timing and making sure they're taking their dose effectively because they got those questions answered as well. And finally, these APPs are very conscious of the price and the cost of medications. So it's important to understand that because, for example, if there's a lower cost product on the market, helping to clearly differentiate the value of your product to overcome that concern about cost is particularly important with this group of prescribers. So let's talk for a moment about how you reach this audience and why it's a little different than the HCP efforts you're already doing. So first, these folks participate in different channels. There are APP specific walled gardens. There are associations specific for these folks. There are just different places that you would reach them. And even in what's more traditionally thought of as DTC or patient channels, you can find these providers participating in those as well. So there's different places we go to look for them. We serve them different content while they still want to understand the clinical and practical components of your product and the value proposition. They also want to understand the emotional content, the patient quality of life, the side effect management, and as I mentioned a minute ago, the affordability of the product. All of those things are really important as well to include in your content. They're more hands-on. So in many cases, they welcome reps and are a way if your reps are having a hard time getting into a practice to actually get FaceTime with a provider and to share your messages and your information. They really enjoy interactive content like quizzes and things like that that give them a way to not just learn. You know, these are folks that have gone back to school mid-career in many cases. So these are lifelong learners. So giving them any opportunity to learn or continue their education, especially if you can make it a little bit fun with things like quizzes, they're going to really gravitate toward that. And also, it's good to note that while these folks, in many cases, will not be traveling to the major congresses because they're a lot of times covering for the HCP that's attending, it's important to create interactive content for them to consume because they do follow conference hashtags and consume the information around the conference because they don't have the ability to go in many cases. So creating that is really important as well. And we also look a little differently at how we target them. So they all have NPI numbers, so we can use that. And there are some specialty designations, but ICD-10, 9 and 10 codes are probably the best way to go because we do actually see APPs move between specialties much more often than we see HCPs. So making sure they're still in the same area you're trying to target is really important. There's professional associations like POCN. We can target them with DTC social, as I mentioned. And finally, when we look at influencers, we have found that HCP influencers are a great source of learning, but they are more for consumption than they are for engagement. If you really want to engage those APPs, having a peer-to-peer APP influencer works far more effectively. So the next key opportunity for us in our 25 marketing programs is to revisit and unlock the power of the comments in our social and in our social media efforts. So why is this such an important thing? Well, first, people believe people far more than they believe um, far more than they believe any ad we're going to put out. So if we can share their opinion of our product or share their experience, this is far more effective and leads to a much higher click-through rate and increased social conversions. And those comments have very distinct values. As I mentioned, they give us credibility. And one of the things that responding to comments does is, especially if somebody is seeing a specialist for it, they're usually only seeing their specialist a couple of times a year. So what happens there is they have a question about your product, or maybe they're interested in your product. If they have to wait for 6 months to see their specialist, or maybe even 12 months, they've likely forgotten about your product and forgotten their question. If they can ask it and you can answer it right then, you're far more likely for them to reach out to their HCP mid-cycle and ask about your product. We can harvest this as a source of insights so that we can understand the best ways to target our audience when it comes to SEO or the types of words we use in comments. And those kinds of things are very valuable. We can also use comments as a way to evaluate the success of the ad content itself. Are people interacting with it? Are they asking questions? It's pretty easy to tell if they get it or don't get it when you start diving into those comments. We can also, comments also help build community and awareness. The most successful social content then gets shared within, let's say, a Facebook group that is specific to the condition. And that's kind of the holy grail, because that is where people are actively discussing the condition, and your content being shared by a community member into that community is not only an endorsement, but it reaches an audience that you may not be reaching. And that also brings new people to consume your content, and draws in more focused audience for you. And it drives the algorithm to drive additional free bonus reach for your posts and your ads based on the kind of engagement they received. So let's talk a little bit about the types of programs that you might have to gather those comments and use them effectively. So the first scenario I'm going to share here is if you have comments turned on your program, you can harvest those comments to be used in social media, like the example on the right here. There is a process that I'm going to go through kind of step by step on the next slide, where you can ask for permission to use that piece of content and gain that permission all in direct messages in the social platform itself. And then you can use this type of content as a source of patient comments that you can use as content. Now, I'll just call out, you might immediately think, how many people would say yes to that? And so here's a benchmark of these programs that we run. 56% of people that we reach out to and ask if we can use their comment or their story say yes. 13% say no, and 31% either don't see the direct message or don't respond to it. I would guess that's probably a higher response rate and a higher yes rate than you might have thought. So let's look at the process that we actually use to get permission to use this content. So we start by locating the UGC that aligns with what the client is looking for and the type of content we're going to be creating. We then share those posts with the MRL team and have them and talk through the ones we could use, or if we would need to edit them a little bit or take something out in order to be able to use it. And we narrow it down to the ones that we think have the highest value. Then we actually reach out via direct message and ask somebody if we can use that piece of content. And that includes us, disclosing how we're going to use it. And they have to say yes to a set of terms that we would share, that include things like permission to use their likeness or their comment, saying they haven't been paid by the company, sharing the privacy policy, all of those, saying that they are not affiliated with the company, and then giving them waiving their right to the final review and review of any copy changes or things we might use, and if they're going to supply an image, the right to use that image and things like that. If they say yes, then we follow up with a DM saying, thank you so much. If you stop taking the product, let us know. Or if you ever want us to stop using your likeness, just send us a direct message. So we give them some instructions and thank them for their time. If they say no, we also send them a direct message saying thank you for your consideration. Ultimately, we file this information to make sure that we have an audit trail. And each year, if we continue to use this content, we reach back out to make sure they're still on product and to gain permission again. And finally, we go through and create the content. It goes through the full MRL process, just like any other piece of content would. So that's our first option, is taking that comment that has a great story behind it and using that for a piece of content. The second one is more about getting longer stories, and this can be done in a couple of ways. Ideally, this is to gather, whether it's an audio or video or even an image, a little bit more in-depth story. So I'm going to share an example here of a story that is an audio format that we collected for Real Food Blends, one of our clients.
Any families that are considering real food blends as their option for blenderized diets, I would highly recommend it. Number one, it's made with 100% real foods.
So I won't play the whole thing, but you get the idea how you can even take an audio snippet of a story and really make that into compelling content. And to do this, you can do it in a couple of ways. First, and this is, it's important to understand the age of the target audience you're trying to get to do this. If it's a younger audience, then creating a website where they can upload a video or upload images in a written file format is a great way to accomplish that. We see that when you change platform, and if you're requiring somebody to do a video, for example, that sometimes we lose the older generation. So depending on your product and where you're trying to reach them, inviting them to have a phone call about it can be a very effective way to do it. We gain permission to record the call. We explain the uses, do a lot of the same disclosure stuff that we did before. And then we ask them about their story and get that on recording. So if it's a really good story, we might edit it for use. If it's a story that we think we would like to get on video, we can invite them to have a full content capture where we do a video recording of their story. And if it's just not something that we can use, then we could just discard it. So there's another way for us to gather these stories and really connect with folks and have that dialogue that really often drives them to want to share their story, especially if it's a generation that is less comfortable with talking about their healthcare experience or is less comfortable with the technology that might be used to record a video of them online. So those are three things that we hope that that are of value to you as you think about what you're going to do next or how you're going to up your game in 2025 and as we go into planning for 2026. Don't forget that comments are hugely valuable and there's a lot we can do with them, that our APPs are not just another part of our HCP marketing, and that there are channels out there that we may not be considering. So that's your tips for the day. Hope that this has been useful and appreciate you taking the time.